There is something in your life's work that drives you toward greatness. It gets you up early. It quickens your pace. It sharpens your vision. It's not a single technology, process, or metric. It is the confidence that you will make a difference today, that you will deliver the right answers to real people who are counting on you.
That drug, in essence, lopped off the head. And it was that action, the repetitive nature of it, that bought the time. And so with an expected prognosis of 9 months, it went on altogether for 10 years. And I look back, and what I would say is a positive is that, to my point about the importance of the pathology lab, is that the lab was a big factor in generating a high level of information, which informed his therapy, which was the most intelligent way of dealing with the multi-headed serpent.
Talisa lives in Bourtois, Africa, where physicians are scarce. In her country of Cameroon, 5,000 people share a single physician with the expertise to diagnose and treat cancer, the second leading cause of death in developing countries. Talisa and her mother have to travel several hours by bus to reach the nearest medical facility with the basic technologies required to diagnose what they fear may be cancer.
Wonders that once seemed out of reach now sit comfortably in the palm of an ordinary person's hand. So why are some of the most critical technologies in cancer diagnostics stuck in the 70s? The music, the hair, the cars, and the wardrobe were wild. And who could forget those outrageous platforms? We retired those for a reason. Some moments that made the 70s a decade to remember are still relevant today, but medical technology that hasn't evolved in 30 years is more than outdated. It's dangerous. Today, 14 million patients worldwide are counting on the critical biological insights only H&E can provide to inform their diagnosis.
No, you're not, she argued. I promised Mrs. Smith that her test results would be ready in the morning. Every time Catherine collected a tissue biopsy for Tom, she learned the patient's name. Tom turned around and went back inside for another 3 hours, reading every detail the tissue stain revealed. Early the next morning, the results were delivered to the patient's oncologist, who immediately phoned Tom. "This is fantastic," he shouted into the phone. "I want you to do this for every one of my patients." Tom reluctantly declined and hung up the phone to find Catherine glaring at him. "You said no," she pointed out. "No matter how much I want to," he said sadly, "I can't give every patient answers this quickly." Without hesitation, Catherine shot back, "Then build something that can." That moment began a quest to improve the practice of medicine. Tom Grogan built the first automated tissue biopsy stainer, creating a new standard of quality and reliability. These ideas change our world, whether we're ready or not. Individual slide staining for H&E is ahead of its time because we build now what patients need next. In medicine, a single idea can fuel innovation that touches thousands of lives. This is why we cannot hesitate. Today, we bring the precision of automated H&E technology and the promise of individualized cancer diagnostics to labs worldwide. Are you ready to evolve? Think about lung cancer, the #1 cancer claiming lives around the world each year. We are conducting studies to develop an assay with the potential to identify patients for a personalized therapy that has been shown to shrink tumors in more than half of patients whose lung cancers demonstrate the ALK gene change. We are committed to delivering tests that can help to improve and extend life by spanning the gap between generic and personalized treatment. We are also the world leader in companion diagnostics for breast cancer, helping patients worldwide qualify for treatment with Herceptin, a highly effective personalized therapy. We are developing similar technologies now to target patient populations in lymphoma, colorectal cancer, and other key diseases. Drawing on our 25 years of experience in biomarker development and working closely with pharmaceutical trailblazers, from visionary startups to medical...
These are the makings of a masterpiece. When it comes to cancer testing, every slide is priceless because it represents an individual. You and the patients who trust you to provide the answers they need to fight their disease deserve nothing less than the finest images available for H&E, each one painting a vivid picture of a patient's story in exquisite microanatomic detail. Experience the new Ventana HE600 system, a highly evolved technology for H&E staining that makes every patient's slide a masterpiece.